what are the surroundings, that kind of stuff. And I think that's great. Like, I like to just get rid of that monitor for a minute.
Stop binging.
Yes. Just turn it off. And then do your job like you said, without electricity. And I think you can learn a lot that way. So I would also say, too, that I think maybe physicians or people in the emergency room versus people in the field, like we were kind of talking about earlier, we don't completely understand one or the other unless you have experience in both. And I would say that, like, this is the same anywhere. Not all providers are created equal. And so, like, if you've had a poor experience with someone from the field, that doesn't mean that, like, the next person is going to be that way. Like, the next person might have a lot more knowledge and skills than, you know, the previous. And so just to make, like, an assumption based off of that one person is not fair.
One thing I think that paramedics don't realize about nurses is that nurses just want to know if the patient has an IV. They're not criticizing you for not starting one. They just want to know if they have one and if they need one.
I just want to know if they have a pulse.
Yeah, because that's the first thing that you do when, like, in the ERs, you're like, well, I got to draw my labs.
Yeah.
So.
Like, do they have an IV? I'd always be like, no, and I couldn't start one because we were only 3 minutes away from the hospital, and I didn't have enough time, and I was taking their vital signs, and then I had to call in, and they were like, no, I just want to know if they have one so we can start one.
Yeah.